logical progression, doing your own sort of self-critique of what's going on with the patient, I think was the gist of where you were going with that lecture.
Yeah, and I think that's part of what I've already been saying to a large degree. It's doing what's most logical. Again, trying to do the most predicted procedure, and the other thing, I think, if it's your own complication, don't bury your head in the sand. I always like to say this in front of a large group, and it's amazing how many people laugh and shake their head if they understand. If you have a patient you've done surgery on, even if it's a hammer toe or a bunion, and they're having a complication, it, and you look at your schedule at the beginning of every day, and you look down the schedule, and you're seeing who's coming in, and you see that patient that's having the complication. I mean, your day doesn't become enjoyable until that patient's come and gone. I find the key way of kind of stopping that is being very upfront with my patients about complications, and I don't get defensive about it. Complications are part of any surgery we do. And I go in, I explain to the patient, they say, hey, it looks like my bunion's coming back. Hey, it's swollen. And I look at it on an x-ray and maybe the osteotomy has shifted some. I tell the patient, your osteotomy has shifted some. The bone cut's not exactly where we left it. And I don't play a blame game. I don't say you must have kicked something or you must have fallen. I just say, it's not optimal alignment. And if I think it needs to go back to the operating room, I don't say to the patient, well, let's just see how it's going to do. I take the patient back to the operating room and I put it where I know it needs to be. And I probably don't go 6 months where I don't have a patient that either before they leave the hospital or the surgery center, we're taking a post-operative x-ray and I don't like something. And I took a fluoro earlier and everything looked fine. And now I take an x-ray and I don't like it. I say, don't let that patient go home.